Transitions. They're never easy. Few of us are any good at them. At best, we engage in some research and we still end up kind of stumbling through. Usually it's fine. It's the scary part. At some point in medical training, you do get familiar with the usual suspects, but it takes a lot of time. I've gone through more than most, and transitions are still very stressful. But why is it that these transitions in medicine are so unpredictable? Each of us is just dumped into some type of choose your own adventure story. Why is it that there's so much more anecdote than concrete steps? I do have some thoughts. Lack of network. It's daunting to approach people more senior to you in training about events that don't directly pertain to your work. If you have people like that in your corner, you should consider yourself lucky. I have many of those people now, but there are moments in my training where it just never seemed like the right time. And when you do get some feedback, it may not always be applicable to you, which leads me to my next thought: cognitive bias. There's this thing called the peak end rule, which essentially means when you go through a difficult process, the result can significantly impact how you recall that event. Take going to the dentist, for example. It can be very painful to get a filling, but at the end, when you no longer have a toothache, there's enough positivity in that experience to make you go back again and again because you see the intrinsic value of someone checking on your teeth. I think this positive bias is actually true for a lot of doctors. They made it all the way to the end, and they can acknowledge that training or interviewing or moving was very hard and that they were stressing at the time. But if it worked out all right, they generally look back upon it as nothing to really worry about. That's why there's so little advice to pass on to you. Evolution. While medical training has become much safer and much more regulated, it has also become increasingly more complex and litigated. The amount of onboarding and credentialing work is immense and requires so much more time. This compresses the amount of time that you have to actually get settled between stages of your career. Inflation. Medicine is an economy of scale, and it's subject to rising costs. For the most part, salaries for medical personnel have not risen proportionally, and of these fiscal concerns, resident salaries are hardly at the forefront. So, when you move, a lot of the financial and logistical burden just falls on you or your family. So, you can and you should prepare as much as you possibly can. Elicit a diversity of experiences and plan for whatever contingencies that you can foresee, all the while knowing that your specific journey needs to be undertaken empirically. That's what I can do. I'm Brian. I just finished my 8th year in independent plastic surgery training pathway. It's very rigorous, and now I'm a fully trained general surgeon and plastic surgeon. But I'm not done yet. I've chosen to undergo one more year of fellowship, and while I'm in the thick of it, still experiencing these things, maybe I can share my experiences to help some of you to follow. If you enjoyed my content today, please like, comment, and subscribe. Follow along with me in my journey, and I hope to see you there. Thanks for your time. Take care.